Hello, my name is Tom Osborne, President and CEO of Parkridge Health System. I'm reaching out to all the people in the Chattanooga area. First and foremost, I hope all of you and your loved ones are safe and healthy. We know these are trying times and scary times with COVID-19 and the virus. One of the things we wanted to do today with you was to show you that it is safe to come to the hospital. One of the things that we've been worried about is our patients that are in emergent needs. They're fearful to come into the hospital because they're scared they might get COVID-19. So we thought we would walk you through the process of how we protect you as a patient when you come into our hospital. And so first I would arrive here at the ED. I would be masked. I would come in. I'd use my hand sanitizer. I'm going to introduce you to Robin Marsh. Robin is our director of the emergency department. One of the first things we would do is we haven't even entered the emergency department yet. We're right in the vestibule. And the first thing we do is you'd meet someone like Megan. And Megan, what would you do for us right when you came in as the patient? What would you do?
You guys are already masked. If you didn't have a mask, I would go ahead and offer you one. Ask if you're having any shortness of breath, cough, and then go ahead and check your temperature.
Okay.
And you are good.
Okay.
So we're going to allow you to go in.
Okay, so now we can go in. And normally patients here at the ED, if we had a lot of patients like we normally do, patients would come over here and they would be waiting in the waiting area. But because of COVID-19, one of the things that is really important is to try to get patients back to the room immediately. And so we don't have people waiting in the same space together. And so that's one of the things we put in place to have really a fast access into the ED. Next, we would come to the registration window. Beth is here. So Beth, tell us what you would do at this point.
Yeah, so I would ask them to put in their social security number and then verify their name and their birthday, and then get their complaint and then walk them back to a room.
And Beth, after every use of this keypad, you'll wipe it down and clean it before the next patient's allowed to use it. Is that correct?
Absolutely.
Yes.
Awesome. Great. All right, let's
Beth,
go.
Let's go to the room.
Okay. So now we're in the room, and again, still have Robin here with me. Just as a reminder, we've come into the ER. We've been screened for temperature check. We've been asked questions about whether we've traveled or had a fever or a cough or anything like that. We've come in. We've bypassed the waiting area. We've gone straight to registration. And registration has immediately placed us into an ER room where we have no other patients. These rooms are cleaned consistently and constantly. And so what would take place at this point?
So at this point, typically, even before entering the room, we do hand sanitizer, wash our hands, make sure our hands are clean. And then we'd assess our patient by getting vital signs. With each new patient, we have disposable cuffs. That if they're admitted, they go upstairs with, or they're thrown away after each patient. We get vital signs, see what the patient needed as far as medications, etc., and just make sure everything's clean and everything's disposable that needs to be, and everything's super clean afterwards that would be reused.
Awesome.
And the physician comes into the room to see the patient here at the bedside. Any orders or procedures or treatments that would be needed occur in this room. If they have to travel outside of this room for an x-ray, then their mask, the radiology tech that comes to get the patient for that transport, is also masked, and everyone's clean and their hands are washed before they take that patient to that space for those tests.
We know that this is a scary time to come into a hospital, to come into an ER. Through COVID-19, we have seen our volumes really reduce by substantial amounts, and some of those areas are areas that we're really concerned about. We've seen a 50% reduction in our chest pain volume, and a similar reduction in our neurological patients. And our concern is that maybe you are putting off that care because you're worried to come into the hospital because of COVID-19. So I'm here with Dr. Cunningham, who would be seeing me as a patient. Dr. Cunningham, what have you seen, and what has been some of your experience in regards to what's happening in the ER?
So we've seen a lot fewer patients in the emergency department, and we've actually seen a lot fewer people in the emergency department with complaints like chest pain, stroke-like symptoms, but the people that we are seeing are having worse symptoms by the time they're coming in. So our concern is that people are putting off coming to the ER until, it's almost too late to do anything about it. While this virus is very dangerous, it's important not to delay care until it's too late.
Yeah, thank you, Dr. Cunningham, and that's what we're really trying to instill with you today, is that it is safe, and we have taken so many precautions to keep you safe and to make sure that coming into the hospital is a safe option for you, and that COVID-19, while is something that I'm sure you're concerned about, I hope what we've showed you today with all the precautions we're taking make you feel a little bit more comfortable, and you don't delay the necessary care in order to make sure that you stay healthy and are getting the care that you need.